I'm not. Wash my hands, provide privacy. My name is Melanie and I am going to be your nurse today. And we are going to be doing a head-to-toe assessment. Can I have your name and date of birth, please?
Savannah, 6/21/06.
Okay. And do you know where you are?
At the hospital.
Okay, and do you know what month it is?
December.
Okay, patient is alert and oriented ×3. Her posture is upright, her speech is appropriate, and her hygiene and clothes appear to be clean. Just a little. There you go. Okay. I'm just going to inspect your head now. Okay, I'm just going to palpate. Okay, I don't see any bumps, I don't see any lesions or parasites, and hair is distributed evenly. Okay, I'm gonna look into your eyes. I don't see any redness, I don't see any discharge. See your nose. It's pink and moist. There's no redness, there's no discharge. Open your mouth. Pink and moist. Look in your ears. There's no redness or discharge noted. Okay, I'm gonna have you close one nostril and then breathe in. Okay, and then close the other nostril, breathe in. Okay, cranial nerve 1 is intact. Okay, I'm going to check your peripheral vision now. So close one eye, cover one eye. Okay, and tell me when you can see my hands.
No.
Okay.
No.
Other eye.
No. No.
Okay. Cranial nerve 2 is intact. Look at my nose. Should light each eye. Okay, pupils are equal, round, and reactive to light. Go ahead and follow my finger. And accommodation. Okay, follow my finger with just your eyes. Cranial nerves 3, 4, and 6 are intact. Go ahead and move your eyebrows up, eyebrows down, puff out your cheeks, smile with your teeth, close your eyes. Okay, tell me where I'm touching.
Left cheek, right cheek.
Cranial nerves 5 and 7 are intact. Okay, open up, say ah. Okay, uvula rises with phonation, the tongue is midline, there's no lesions noted. Go ahead and stick your tongue out, wiggle it. Okay, put it back in. Go ahead and swallow. Cranial nerves 9, 10, and 12 are intact. Okay, I'm gonna have you apply pressure to your shoulders and push against them. Okay, cranial nerve 11 is intact. Okay, I am going to shine a light in your nose. Your nasal mucosa is pink and moist. There's no deviation noted. Nasal patency is intact. I'm going to look in both ears. No subrumen, no discharge or lesions noted. Close your eyes. Tell me what you can hear and where.
Left ear, right ear.
Okay, cranial nerve 8 is intact. Okay. I'm going to palpate your lymph nodes now. Okay, we have the preocular, the postocular, the occipital, the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical, the supraclavicular. Okay, now we're going to move on to your lungs. Okay, the anteroposterior diameter is less than the transverse diameter. Okay, I'm just going to look at your chest and I'm going to go ahead and calculate your respirations. Go ahead and just breathe normally. Okay, fast forward 1 minute, your respiratory rate is 15, your respirations are even, they're unlabored. Symmetrical chest rise and fall with breaths. There's no accessory muscle use and there's no cough present. Okay, now I'm going to listen to your lungs. So you're going to do a deep breath in and out each time my stethoscope touches you. Okay, go ahead and turn around. We'll do it on the back. Okay, all fields are clear bilaterally. I'm just going to percuss on your back. Costovertebral tenderness is negative. Okay, say 99 each time my hands touch you.
99, 99, 99, 99.
Okay, tactile fremitus is negative. Okay, take a deep breath in. Let it out. Thoracic expansion is equal bilaterally. Okay, now we're going to listen to your heart sounds. You can go ahead and turn around. Okay, we have the right sternal border, second intercostal space, the aortic valve, the left sternal border, second intercostal space, pulmonic valve, the third intercostal space, Erb's point, the lower sternum border, fourth intercostal space, tricuspid, and the fifth intercostal space, mitral. So S1, S2 were heard. There's no extra heart sounds and there's no murmurs. Okay, I'm going to touch each carotid artery one at a time so you don't pass out. Okay, pulse is 2 plus over 4 plus. We'll listen to both carotid arteries. Okay, hold your breath. Okay, release. Deep breath. Release. There's no bruits noted. Okay, go ahead and take a few steps toward me and then 2 steps back. Okay, the patient's gait is balanced. Feet are shoulder width apart and Romberg's test is negative. Okay, go ahead and follow what I do. One foot out in front, another foot out in front, 1 foot behind, other foot behind. Perfect. Okay, range of motion is equal bilaterally in all extremities. I'm going to go ahead and have you lay down. Just scoot over a little more to the edge if you can. Perfect. Okay. Okay, abdomen looks flat. It's non-distended. Okay, I'm just going to listen to your bowel sounds now. The right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. Okay, when was your last bowel movement?
This morning?
Okay, was there any diarrhea?
No.
Was there any constipation?
No.
Was it formed?
Yes.
Was it brown?
Yes.
When was the last time you urinated?
20 minutes ago?
Was it burning?
No.
Was there any hesitation?
No.
Any urgency?
No.
Okay, I'm just going to palpate your abdomen in each quadrant. Is there any tenderness?
No.
Okay, bowel sounds noted. If I didn't hear any bowel sounds, I would have listened to each quadrant for 5 minutes before I said that they were absent. Okay, I'm just going to kind of feel all the way down your body. Scoot up just a little so we can see your feet in the video. Good. Okay, your muscle tone is appropriate, your skin temp is warm, there's no lesions, and there's no edema noted. Okay, I'm going to check your capillary refill in your fingers and your toes. Capillary refill is equal bilaterally. It's brisk for refilling less than 2 seconds. Okay, now I'm going to go ahead and I'm going to feel all of your pulses. Okay, we have your brachial, your radial, your femoral, your popliteal behind the knee, your posterior tibial, your dorsalis pedis on top of the foot. Okay, pulses are equal bilaterally 2+ over 4+. Okay, so now I am just going to go ahead and check your ankle clonus. Okay, ankle clonus is negative. Okay, I'm gonna check your plantar reflex. Plantar reflex is negative. Bilaterally. Okay, now I'm just gonna have you go ahead and sit up. Okay, just scoot over just a little so you're in the video there. Okay, perfect. Okay. Okay, just relax your arm. Just relax your arm. Okay, your tricep, your bicep, your brachioradialis, your patellar, and your Achilles. Okay, all reflexes are equal bilaterally. Okay, I'm going to have you squeeze my fingers. Okay, and then your legs, resist against them. Okay, are you comfortable?
Yes.
Do you have any questions?
No.
Okay, well that concludes my exam. Here's your call light, your personal belongings. I'm going to take off the privacy, and I'm going to wash my hands.